Leukemia is a group of blood cancers characterized by the uncontrolled proliferation of abnormal white blood cells in the bone marrow and peripheral blood. This overproduction interferes with normal blood cell formation, leading to anemia, infections, and bleeding tendencies. The pathophysiology of leukemia involves a step-by-step disruption in the normal development and function of white blood cells, WBCs, in the bone marrow, leading to uncontrolled proliferation. Step-by-step pathophysiology of leukemia. 1. Genetic mutation or damage to hematopoietic stem cells, HSCs. Trigger: exposure to radiation, chemicals, e.g. benzene, viral infections, or inherited genetic mutations. Effect: mutation in DNA of a single hematopoietic stem cell in the bone marrow. Result: loss of control over cell proliferation, differentiation, or apoptosis. 2. Clonal expansion of abnormal cells. The mutated HSC begins to multiply uncontrollably. All resulting cells from this mutated stem cell carry the same genetic defect, clonal population. These cells are immature or non-functional leukocytes, called blasts. 3. Impaired differentiation of leukocytes. The blasts fail to mature into functional WBCs, neutrophils, lymphocytes, etc. Bone marrow becomes filled with immature leukemic cells. These cells do not perform normal immune functions. 4. Bone marrow suppression. Overcrowding of bone marrow by leukemic blasts suppresses normal hematopoiesis, results in anemia, RBCs, fatigue, pallor, thrombocytopenia, platelets, bleeding, bruising, neutropenia, normal WBCs, infections. Infiltration of organs and tissues. Leukemic cells spill over into peripheral blood. They may infiltrate lymph nodes, lymphadenopathy, spleen and liver, hepatosplenomegaly, CNS, headache, seizures, skin, leukemia cutis. 6. Systemic manifestations. Constitutional symptoms: fever, night sweats, weight loss, immune dysfunction, recurrent infections, hyperleukocytosis, especially in acute leukemia, blood thickening, leukostasis, stroke-like symptoms, respiratory distress. 7. Progression and complications. Without treatment, the disease progresses rapidly in acute leukemia or gradually in chronic leukemia. Complications include severe infections, bleeding episodes, organ failure, bone pain due to marrow expansion. Summary of the pathophysiological cycle: genetic mutation, clonal proliferation, differentiation block, bone marrow overcrowding, pancytopenia, infiltration of organs, systemic effects. Thank you. Have a nice day.